come in.
I'm washing my hands. Hi, Paul. How are you?
Good, how are you?
I'm good. My name is Nancy. I'm a nurse from Harper College. How are you doing today?
Doing just fine, thank you.
I'm here to do an assessment of your nose and your mouth and throat. Is that okay?
That sounds fine.
All right. I'm going to start with 2 questions. Any problems with your nose, like frequent cold, sinus infections?
No,
Any problems with your teeth or mouth that you're aware of?
no.
All right, good. So I'm going to start out, I'm just looking at your nose, and I see that your nose is in the midline like it should be, and it's symmetrical. I'm looking at the septum, and it's right in the middle. I see both nares are the same size. I'm going to touch your nose now. I'm just palpating for any pain or tenderness here. All right, and then I'm going to check your sinuses. Tell me if you feel any pain with this. It's
No.
the maxillary sinuses and the frontal sinuses. Any pain with that?
Nope.
And then can you plug one nostril and breathe in? Any problem with that?
No,
Other side? Okay. Any problem with that?
no.
All right, so both nares are patent. That's good. Then we're going to move on to, I'm looking at your mouth. I first start by looking at your lips, which are pink and moist, and there aren't any cracks or anything abnormal there. And can you show me your teeth? All right, and can you open your mouth so I can see your teeth? Here, put your chin down a little so I can see. There you go. All right, so your teeth are wide and they're in line. I don't see any dental caries. I also was looking at the gums. The gums are pink and they're nice and tight around the teeth. I don't see any evidence of any gum disease. And then I'm going to need to look in your mouth. So can you open again just really wide? There you go. Kind of stick your tongue out a little. All right, good. And lift your tongue up. All right. Okay, good. You can close your mouth for a second. So what I was looking at is the dorsal surface of the tongue. That's the top of the tongue is rough and pink. And then the ventral surface of the tongue is shiny and you see veins. And then the bottom of the mouth, underneath the tongue, that's a place where cancers are likely to start. So that's all pink and moist, so I didn't see any signs of any lesions in that area. And then can you open up again? And I'm looking at the buccal mucosa, which is pink and shiny. And I'm looking in the back, up at the roof of the mouth, there's the hard palate, which is whitish and has rugae, and the soft palate is pink. The uvula is pink in the midline. The tonsils are pink, they're not enlarged, they have deep crypts, that's normal. And say ah.
Mm-hmm.
So when he says ah, I see that the uvula and the soft palate rise, and that is cranial nerves number 9 and 10. And last thing, can you stick your tongue out? And that is in the midline. You can put it back in, and that is cranial nerve number 12. And that concludes our assessment of the nose, mouth, and throat.